outbreak. New York State has declared a public health emergency. More than 19,000 cases of the flu have been reported there. The U.S. Centers for Disease Control say the flu is widespread right now in 47 states. Children have been especially hard hit, with 20 deaths among them reported. Now, as the flu epidemic continues to make thousands of people sick across the country, we thought we would separate the fact from the fiction. What are the myths and what are the realities of this year's flu strain? Well, NBC 10's Monique Braxton is live at Paoli Hospital in Chester County tonight. Are they seeing a large number of cases there, Monique?
Yes, they are, Denise. Good evening. The chief of emergency medicine here tells us 20% of the patients that come in here every day have flu-like symptoms.
This year we're seeing a lot of flu cases, but there are a lot of other viruses that do the same thing or give you the same symptoms of the flu, but they're just not the flu. So we're seeing a lot of upper respiratory illness, but in addition we're seeing a lot of GI illnesses.
Dr. Stuart Brilliant says on a daily basis at least 35 to 40 patients who check into the emergency room here at Paoli Hospital have the flu. The Centers for Disease Control says this season the flu arrived much earlier than in years past. Even people who prepared early to combat the deadly sickness are developing influenza. That led us to solicit the help of Dr. Brilliant in telling you the myths and the facts about this year's flu strain. Does the flu shot work?
This year, around 60 to 65% of people are being covered by the flu vaccine.
Some people say the flu shot will give you the flu.
I think that's one of those old myths and wise tales.
What if you're young and healthy, work out a lot? Do you really need the flu shot?
My answer would be yes. It's always better to be safe rather than sorry.
But you don't need to get a flu shot every year, do you?
That's another one of those myths. See, every year the strains of the flu change.
Can you catch the flu from the weather? Like if you go out without a jacket in cold weather, if you have a wet head, you go out in cold weather, or if you're sitting by a drafty window?
Now that is a myth.
Dr. Brilliant adds Tamiflu is prescribed for confirmed flu patients who have had symptoms for less than 48 hours, especially children, seniors, or others with weakened immune systems.
Viruses live inside of your cells, so antibiotics don't typically work. Bacteria live outside of your cells, and antibiotics do work.
But Dr. Brilliant says most of the patients here are told to drink plenty of fluids, treat the fever, and get a lot of rest. He also says he tells his patients try to stay away from other people who are sick. That's the latest in Paoli. Monique Braxton, NBC 10 News.
Well, if you have questions about the flu, call the NBC 10 Flu Helpline. It'll be open on Monday.